Hi, this is Matt talking about stroke. Stroke is one of the most catastrophic injuries that you can have in your life, and you want to prevent having a stroke if at all possible. But there may be the occasion with a family member, a friend, or whoever, where you see that they are having symptoms that are consistent with stroke. And that's why I'm going to approach this topic and review some of those symptoms. Primarily, you want to look at their face. Many times their face has changes. You may notice in their eyes some drooping, and also with their mouth. There may be some drooling from the corner of their mouth. Their speech may become unclear. Their response to you speaking to them may become slower than normal. You know them better than anyone. So if you notice that their response to you talking to them is slowed, if you see these physical signs of their facial appearance to be changed, also if you see that they physically are having difficulties, specifically if their arms or their hands are drooping to one side, and also when you grasp their hands and you try to have them squeeze your hands, and you find that one side is weaker than the other, then what you really need to do is immediately, I mean immediately, get them to the hospital. Because if they're having a stroke, they can have up to 1 million brain cells die each minute. Each minute. So, but if you get them to the hospital and they get treated with first diagnostic tests, a CAT scan, an MRI, then you potentially can have the information necessary to initiate therapy to treat the cause of their symptoms. And that's so important, but you have to respond very quickly, very quickly. And if you do that, you can prevent them from having extremely catastrophic long-term outcomes from a stroke. And this is so important and so essential to that person. You can't believe it. So anyways, if you see anyone, if you're at the mall, you are walking down the street, you are visiting someone, you are at the airport, and you see these type of symptoms where their face appears to have unusual and most likely one-sided changes, weakness, their eyes drooping, their mouth is drooping, their speech is unclear, they have weakness of an arm, they're walking, dragging a leg, or they're having problems with their balance, call 911 immediately. They could be having a stroke. And if they get to a hospital where they can initiate the diagnostic and interventions that can treat a stroke, you can prevent them from a lifelong course of having to do rehabilitation and potentially having long-term disabilities. So, and they would thank you for it. So if you see those symptoms, call 911 and get that person help. And if you yourself are having those types of symptoms, call 911 and get help, because you could be having a stroke. Alright? So anyways, stay fit, and we'll be back in touch.